What's up everybody, my name is Charlie. If you're new here, I make videos about working in a hospital, pre-nursing, my nursing school journey, and I make videos about me being in the military because I am a member of the United States Air Force. But as you can tell by the title, today's video is what I do as a PCT. A couple things I want to say before I get started is a PCT stands for Patient Care Technician. A CNA is a Certified Nursing Assistant. PCNA, Nursing Tech, just a tech by itself. There's so many different names. This is all the same job. We're all nursing assistants, and if you clicked on this video, you must be interested in it. You're gonna be doing it. You have an interview soon, something like that. And I do plan on making videos all about my interview process and anything if that's what you guys want to see. But as you can tell by the title, today is gonna be what I do in a normal 12-hour shift. Another thing I want to say before I get started is every facility is different. There's different things that you might be able to do that I'm not able to do. There's things that I'm not able to do that you're able to do. But from what I know, Alabama, which is the state I live in, we usually have pretty basic rules about everything. We're never caught up with the times. I know some people can like draw blood and do IVs, take out catheters, put in catheters. I can't do any of those things. But here's the things that I am able to do. Okay, let's get started. The first part of this video, I want to tell you like pretty much my whole schedule of my 12-hour shift. I work night shifts, so I get to the hospital and I clock in at 6:30 p.m. As soon as I clock in at 6:30 p.m., I go to the nurse's station, I get my assignment, I figure out which hall I'm going to be on. In my hospital, our unit is split up by 3 halls. All of the halls have 15 rooms. We usually have about 12 patients in, per hall. So let's say if I'm on A hall, I talk to the A hall day shift tech and she'll give me a report. Before I get a report, I usually go get the patient's list from Epic, which is the charting system we use, and I write on my report sheet just so I can write down everything she's telling me. So when I go to get a report, she'll say, okay, here's the patient in this room number, and I'll have it already on my paper. She'll tell me whether they're independent, whether they can bathe themselves, walk themselves, use the bathroom by themselves. That's really important to know. If they have briefs, so I can make sure I'm changing them and checking them and everything. She'll tell me their mental state, really everything about them, why they're there in the hospital, how's their mood, which is really important to know. If they know they've been fussy all day, this is what they like, this is what they don't like. She'll tell me if I have to check their blood sugars or not, because some people you have to check and some patients you do not. And they'll tell me if she has already given that patient a bath or not. I keep saying she because all the techs in my hospital are girls. There's obviously men techs too. But that's pretty much the most important things that she'll tell me. So at that point, it's about 7 o'clock p.m. 7 o'clock, that's when everybody clocks out and everything. That's when I go through Epic again, look at my patients. And that's usually when I start rounding. So on my first initial rounds, I'll go in, I'll say, hey, my name is Charlie, I'm gonna be your tech tonight, and this is who's gonna be your nurse. I get my expo marker and I write down my name, the nurse's name, the date and everything. The date obviously hasn't changed yet. Don't know why I said that. Anyways, I write down all the information on the board, ask them how their pain is, ask them if they need anything, any water or anything. If they're NPO, I usually make sure they don't want to snack before midnight and everything. And just like really quick, that first initial one's like 5 minutes. Go in there, straighten up their room real quick, introduce myself, and then I go do that for all 15 of my patients if I have a full hall. By that time, my nurse is usually done with her report, so I'll go check in with her and make sure there's not anything I need to know, and then I'll start on my actual rounding for vitals. So before I get vitals, what I will do is get my Dynamap. My Dynamap is just the machine that we use to take the vitals, and I'll wipe it down, sanitize it really good, and then I'll stock it with gloves, face masks if I need them. I'll put my AccuCheck machine in there, which is just the thing that you use to check the blood pressure. I'll put my lancets in there. I'll make sure I have everything that I'm gonna need when I go in the patient's room. I like to organize my cart a specific way. I make sure I have sanitizer wipes in there in case I need to wipe something down. Anything I need, so once I'm in the patient's room, I can be in and out. So yeah, that's when I go around and start doing vitals. Vitals is just blood pressure, heart rate, respiratory rate, which I have to count like in my head. I know I'm missing something. Blood pressure, heart rate, oxygen, respiratory rate, temperature. Okay, I knew I was missing something. Okay, cool. We're on track. I'm so sorry. My head is so scattered right now. Also, if you see a change in the lighting, it's because I have my ring light, but I'm also in front of a window and it's raining outside. So yeah, that's what I go around and get. If they are someone who needs their blood pressure checked every so often, or every however many hours, or just once before the shift, like right at the beginning of the shift, I'll make sure I check their blood pressure, see how sweet they are. That's usually how I say it. I don't know why. I just really like to go in really cheery. Even though I work with older patients I'm on a med-surg floor, they usually like when I go in there happy the first time. I don't really do that at 12 o'clock because at 12 o'clock I try to get in there and out. Okay, speaking of 12 o'clock, so after my 8 o'clock rounds are over, after I get my first set of vitals, I'll go talk to the nurse, let her know if anything's important, if anything's too high or too low, and then I'll go chart. Charting's not my favorite thing to do. Also, I'm in there, I make sure nobody needs to go to the bathroom or anything like that. Make sure they have their water, make sure everything is in reach, and make sure they are happy and comfortable. And then I chart. I make sure I chart their input and output and everything. That's just when they use the bathroom, all their vital signs, whether they've been bathed. I don't do bath as soon as I get there because I'd have to do it again. And yeah, chart everything. I just take all the information that I just took from the vitals and I put it on the computer. And like I said, the program that we use is Epic. Another thing that's different from day shift and night shift is that I don't do hourly rounds. I usually do my rounds every 2 hours, maybe every 2.5, because when it's nighttime, they don't want you in there and out of there every hour. Because that would obviously be annoying when you're trying to sleep. So yeah, we just do 2-hour rounding. Also, when I'm not in there, the nurse is in there, so I know that has to be extra annoying. And then like lab has to come take blood, and then if they have like respiratory or if they have surgery soon, other people are coming in. Some doctors might be doing consults on them. I try to stay out of their way and only go in there when I'm rounding, when I know I need to, when I'm doing vitals, and if their call lights on. So between doing my first set of vitals and my second set of vitals, I usually take a 15-minute break about 11 o'clock. And another thing that happens between my 2 sets of vitals is I'm just answering call lights. Usually call lights are, can you tell my nurse I need pain medicine? Can you turn me? Which I turn every 2 hours as well. Which is just making sure they don't get any bed sores or anything, making sure they're not laying down in one position too long. We turn every 2 hours at my hospital at night. Making sure they have water, making sure they have snacks, crackers, or anything if they're not NPO after midnight. But like I said, this is around 11 o'clock right before I take my first break. Midnight. Like I said, I just have to do all my vitals all over again. I try to do this one a lot faster because I want the patients to be asleep at this point. In the middle of the night, they usually have someone in there with them, like a family member or something. I make sure they're okay. I always say, hey, just let me get your vitals real quick, just so they know I'm not in there to bother them too much. I sneak in. I don't usually cut on the lights. I'll get it real quick and I'll leave. I don't want any problems at midnight. Everybody should be asleep. So then it's back to charting. Fun stuff. Answering more call lights. Making sure my nurse is happy. Going to do errands around the hospital if they need me to do something. I do that till about 2:30. 2:33 is usually when I take my 30-minute lunch break. I usually try to take it a little later so I won't have that much work to do after I get back. But then again, by the time 4 o'clock gets there, I need to be on my stuff because after 4 o'clock, the whole shift speeds up. My lighting is being crazy right now. I'm sorry, guys. So 4 o'clock is the busiest thing when I'm doing vitals and everything because some people are like kind of starting to wake up. That's when doctors are starting to get in the hospital, when they're coming to check on everybody. I have to make sure everyone gets their bath, everybody who wants a bath. I asked them twice, do you want a bath? Then I asked them again, you're sure you don't want a bath? If they say no twice, I make sure I chart it. Hey, they said they didn't want a bath. That's when I take out the trash. I make sure everything's in reach. I make sure the room is really, really clean for the day shift. The ones that do want a bath, that can do their own baths, when they go in the bathroom, well, first, of course, I bring all their stuff in there. I bring new linen, pads that you put on the bed for, like, if they wear a diaper or anything. I bring diapers, the sterile, I don't know what it's called, the little bottle soap that they can use. I bring rags, bed sheets, pillows, everything, a new gown, everything fresh and clean. So when they go in there to clean themselves, I can make their beds and straighten up the room and take out the trash and everything. If they can't clean themselves, I'll usually give them a bed bath. What usually happens is my nurse says, hey, can you help me with this bath? And I'm usually doing the bath and it's not really helping. I'm just doing the bath. But sometimes I get really, really good nurses that they actually, when they say, can you help me with the bath? It's actually both of us doing the bath, and that makes it go way quicker. Make sure everybody's obviously using the bathroom, urinals, emptying Foley bags, and I'll tell you what that is later. Yeah, just making sure the room's clean and the patient's clean at 4, and doing vitals, obviously. Sorry, I'm looking at my notes, but yeah, that's really just making sure everything is perfect for like when the doctors and everything get in there. So then I chart again, because charting is always so much fun, and that's when I have to like hurry up and chart, because usually sometimes I chart even after the day shift gets there, because charting, especially that 4 o'clock, after you have to clean, make sure everybody's changed, make sure everybody's bathed, like that's the one that usually makes you end up charting after you are supposed to be at home already, like past clock out time. So now we're up to 6 a.m. 6 a.m. is when a lot of the staff starts trickling in. They don't have to be there till 6:30 a.m., but that's usually about what time some people start to get there. That's the last round that I'm going on, not to do vitals, because I only have 3 vitals that I have to do. That's when I go in there and say, hey, I enjoyed having you last night, miss, and I say their name, make sure they feel nice and special and warm inside, and good morning, I'm gonna be leaving soon. Your new tech is gonna be, if I know who it's gonna be, I tell them who it's gonna be. She's great. I always say they're great. So I go in there and make sure they don't want any water. That's usually when anybody who's not NPO, I usually take them water. I fill up these big cups that we have, and I take this cart and I push it around and give everybody water that can have it. Make sure everything's in their reach. Make sure they have their phones and everything. If they have to use the bathroom one last time, I'll make sure they use the bathroom, because I don't want the day shift tech to come in and be like, Charlie didn't change any of these patients. I make sure all of my patients are clean. Just because I don't want the tech after me to feel like I didn't do anything, because I think that's how they feel about night shift sometimes, and that's how we feel about day shift sometimes. So we just want to make sure. And the thing is, it's probably neither one of our faults. It's probably just like example, the patient will be like, I don't want a bath, and then right at like 6:15 when I clock out, or I'm getting ready to give report at 6:30, hey, can I get that bath now? And just like, I'm sorry, I have to go around and do everything else, do these vitals and everything. I can try to come back and get it, and sometimes I don't get to them, and it makes me so mad. But when I'm giving report, I tell them, hey, she didn't want a bath till this time, so she's the only one who didn't get a bath. And I feel bad about it, but for the most part, everyone you work with will understand. Sometimes everything doesn't happen. Like, you're only one person. And then, like I said, I give report about 6:30, and I clock out at 7. So this part of the video, I just want to tell you, I'm sorry, I don't even know if I'm looking at the camera anymore. So this part of the video, I just want to tell you all the things that I am allowed to do at my facility. Like I said, it can be totally different from what you're allowed to do. So I'm going to read off this list of things that I do. Vitals, temperature, blood pressure, oxygen, heart rate, respiratory rate, blood sugar checks, bathing and Foley care. Bathing, you obviously know what that is. Foley care is like all their urine output and all their all the liquids that are inside of them end up in this Foley bag. I take the bag, I empty it out into this measuring cup. I write down how, it's really kind of disgusting. I write down how much it is. I try not to splash it on me, and I put it in the toilet, and I make sure I chart it, because that's very important. Changing briefs. I call diapers briefs because that's how we did it at my old job. My hospital, they actually say diapers, and I just really don't like saying that to grown-ups. I don't know. It makes me feel uncomfortable. I do clean linen. So, like I said, when their beds are dirty, or if I just feel like they need new linen, or if they've like got poop all over them, obviously I get them clean linen. I take the old linen, I put it in these big blue bags, and I send it down the linen chute to, I guess, wherever they clean the linen at. I don't know. I don't really worry about it after it's not on my floor anymore, to be honest. Answer call lights. That's pretty much what most of your job is, vitals and call lights. Call lights, which I think I said earlier too, usually just like they want pain meds or water, or some people like call you just so you can like help them find their remote or go get something out of their bag or something. But that's your job, just to make them happy. Give messages to the nurse, which goes along with I need pain meds. They say I need pain meds. I'm like, okay, I'll tell your nurse. I can't do anything. Heart monitors. If they have a telemetry, I go down to the telemetry room, I go get it, and I am allowed to put it on them. Actually, my hospital's changing this now, but as of right now, I'm allowed to put it on them. I think they're about to cut that off, but I just make sure all of their, you know, the little heart monitor, I don't know what they're called, the leads. Just make sure all the leads are in the right place so the monitor room can check their heart rate and everything, make sure they're not in there going crazy. Feed the patients. I really don't feed that much at night because everybody's usually asleep or in PO or just not hungry because they just ate dinner and they're about to eat breakfast. But that is one of my things to do. Sometimes I do have to feed them like little snacks or something, like ice cream, make sure they have their crackers, popsicles, stuff like that. Chart input and output, which I explained with Foley care, and set up the room for new patients. So if we get a new admission, which at night does happen, or either they're transferring from a different floor in the hospital, I set up the room. I make sure they have everything they need to set up the new room that they're going to. And sometimes I have to transport patients. I have to go pick up the patient from the ER or from the ICU or from wherever they're at if they're having a one-day surgery, and bring them up and then set them up and get them comfortable in their room. So yeah, you guys, that's everything that I can think of what I do as a PCT / CNA / PCNA / nursing assistant in a hospital. Sorry that I couldn't just stick with one name because I just want you guys to know how important it is that these are all the same job. Like I said, this is just what I do in my hospital. What you do in yours might be different, but I hope this video helped you. If it did, give me a thumbs up and leave in the comments what else you guys want to see from me. A lot of you guys have been requesting I do an interview tips video, and I will be doing that. I promise. And thanks for watching. Bye.